Good morning, everyone. This is Heidi Wilson. I am the Vice President of Programs here at Strategic Applications International, and I'd like to welcome you all to today's COPS Tribal Mess webinar series. Today's topic is Community-Based Participatory Research, and I will be moderating today's session. Before we begin, I need to let you know that this webinar service includes a feature that allows audio and any documents and other materials exchanged or viewed during the session to be recorded. By joining the session, you're automatically consent to such recordings. So if you do not consent to the recording, please disconnect from the webinar at this time, and you will have access to the information on the web later. So during today's webinar, questions can be asked throughout the presentation using the web-based Q&A system on the screen. So if you take a look at the right-hand side of your screen, you'll see that button. Simply type the questions to the presenter during their presentation, and the presenters will either answer during or after the presentation. For questions that are not answered during today's webinar, we will email those responses back out to everyone who's participating today so that you'll be able to get all the questions answered. If you need technical assistance at any time during the call, please press 0 to speak to the operator. You can also put in the chat box any questions to us if you're having any logistical issues, and we'll try to help you out as much as we can while you're on screen. With that, I would like to introduce today's speaker, Katie Wingling. Dr. Wingling is a medical anthropologist whose research focuses on public sector mental health and substance abuse services, community engagement processes, and participatory research. Dr. Wingling received her PhD from Rutgers University in 1999, where she concentrated on Native American studies. Her postdoctoral studies in anthropology and evaluation were undertaken at the University of New Mexico. She has researched and provided technical assistance to tribes on developing comprehensive programs to address impaired driving. She is currently working on a project that employs participatory methods to tailor a reentry program for Native American women transitioning from prisons to the community. And today she is helping us to learn more about community-based participatory research. So with that, I'd like to turn it over to today's presenter.
Thank you for participating in today's webinar. To begin with, I want you to imagine two scenarios. In the first scenario, a researcher from an East Coast city comes to your community and wants to do a study on meth use. He brings with him surveys and questionnaires to collect data, even though none of these tools have been tested in Native American populations before. This researcher has very few contacts in the community, and he has a hard time recruiting people to participate in his study. Nor did he get permission from the tribal council and the local institutional review board to do this work. He ends up talking to a relatively small number of people, and from this sample, he makes claims that meth use is rampant in your community. When he publishes these findings, they're picked up by the media, both local and national. Reports start appearing on the TV and in the paper that reflect negatively on your community. This researcher goes back to his home institution on the East Coast. You don't see him again. No programs are developed based on his research findings. He goes on to pursue his research pursuits elsewhere. Now imagine a very different scenario in which people in the community invite researchers to work with them to better understand meth use and how it affects people locally. The researcher collaborates with you, a member of law enforcement, as well as local judges, health providers, and people in recovery. You all work on figuring out the right questions to ask, and you get permission from your tribal council to ask them. Local people are trained to recruit folks for the study and to collect the data. Together, you, your team, and the researcher work to analyze and interpret the data. You then take your project to the next step and work to develop programs based on your findings to better address meth problems in your community. Together you agree on the best strategies to share and publish your data, and everybody gets proper credit. And in the end, a trusting relationship is built between the researcher and the community, and they go on to address other public health problems in your community. This second example exemplifies what we call community-based participatory research, which is sometimes collapsed into CBPR, which can be a tongue twister when you say it multiple times. What is community-based participatory research? Well, first off, it's a collaborative approach to research that equitably involves all partners in the research process and recognizes the unique strengths that each brings. So what does this mean? It means researchers and community members work together on equal footing to do the research, and that each brings certain strengths to this endeavor. So, for example, the researcher might know about evaluation design or how to create the best data collection instruments. But without the perspectives of local community people, this research design can't be brought to life. CBPR begins with a research topic of importance to the community rather than the outsider coming in with their own research questions, and has the aim of combining knowledge with action and achieving social change. So what does this mean? You use local knowledge to generate your findings. You use these findings to develop new policies, programs, and interventions, all to achieve a healthier community, to promote well-being in your community, and that's social change. Is CBPR useful to law enforcement? I would argue that it is. It lets police know that their work is appreciated and that they're not alone in the struggle to reduce problems related to drug and alcohol use. It decreases local resistance and increases community buy-in for law enforcement efforts targeting drug and alcohol use. So, for example, in some communities, police get slack for enforcing DWI laws locally. When law enforcement interventions are placed within a community-based participatory research context, there's often greater support for these interventions, and the community actually starts to rally around the police efforts. CBPR incorporates the special knowledge and expertise of police into community-based prevention and intervention initiatives. It allows for proactive versus reactive planning and evaluation. So what I mean by reactive, let's say there's a crisis related to a substance use problem in your community. Oftentimes an intervention will be put in place very quickly. With CBPR, you have a little bit more time to think through the problems, to study the problems, and then to develop a long-term strategy to addressing the problem. CBPR makes it possible to leverage new resources. For example, when you're working with a researcher, they can help you write proposals to support your own law enforcement efforts. They can help you collect and track statistics related to those efforts, so you can better plan your intervention. CBPR enhances access to and use of quantitative and qualitative data. And quantitative data usually refers to numbers or statistics. Qualitative data often refers to the information you get from interviews and open-ended questions. These data can be used to guide and assess the impact of law enforcement efforts. And ultimately, CBPR is really useful for communicating success stories to the community about what's working, about what the community is doing to spearhead novel initiatives to address problems with drugs, alcohol, or other public health concerns. And this can lead to sustained support for these initiatives. So when people see that the initiatives are working, they usually want more of the same. Why CBPR? Well, in that first scenario I shared with you, the more traditional approach to research, we find that these traditional research approaches have failed to solve many health problems facing communities. not just in Native American settings, but in other communities plagued by disparities. Community members are tired of being guinea pigs, and you often hear this in Native communities, and they increasingly want research that addresses their locally identified needs, rather than those needs that have been identified by outsiders. CBPR also ensures the incorporation of community voice, which leads to research that's more scientifically sound. So, for example, in that first scenario I shared with you, you have a researcher who brought in questionnaires and surveys developed for use in another culture and tried to plop it down in your community. That's not necessarily scientifically sound. But when community members are helping to either adapt or develop the data collection instruments to conceptualize the research design, this often leads to more scientifically sound work. And CBPR findings ultimately enable communities to develop their own solutions to pressing health problems. So what are the core principles of CBPR? Well, if anybody reads the literature on CBPR, most articles cite these core principles. First off, it's participatory. What does this mean? It provides going to be done. So the outsider is not coming in saying, this is how you're going to do your research project. No, everybody works together to achieve consensus and to do the work together. So it's cooperative. As mentioned earlier, community members and researchers contribute equally. It's not the researcher leading the show. It's also a co-learning process. The researcher has a lot to learn from the community. For example, how do I ask the right questions? What would be an appropriate research design for this setting? How is it best to approach community members to participate? What are the strengths of this community? And by the same token, the community can also learn from the researcher about implementing research tools and analyzing data and using data to develop new programs. So in this way, CBPR is also about community capacity building. Most of the people who actually do the research in CBPR are local people who receive training and education in collecting the data, analyzing the data, and so on. And in my experience, a lot of people who are involved in CBPR projects, they end up pursuing higher education in research. So it's an empowering process through which participants can increase control over their lives as well as the health of their communities. And ultimately, CBPR balances research and action. So in other words, you're not doing research for the sake of research, but you're doing it with some end goal in mind, i.e., develop better initiatives to address meth use or other drug problems in a community setting. Is law enforcement engaged in CBPR? Well, some of you might actually be aware of what's called the SARA model, and SARA stands for Scanning, Analysis, Response, and Assessment. And the SARA model really adheres closely to most CBPR models. And I should mention there's no one way to do CBPR, and it really depends on your community and how you want to approach this research endeavor. But with SARA, you usually start off with scanning, and here you identify problems of concern to the community and to the police, and you look at the consequences of these problems. You study or collect data to better understand the problems and to prioritize those that y'all are going to address. During the analysis phase, you look at what you've done to address these problems and what's not working. And then you try to develop strategies to overcome some of the limitations of what you're doing now to address the problems. When you're in the response mode, you brainstorm new interventions based on your analysis. This might involve finding out what folks have done in other settings to combat the same problem, or it might actually mean developing your own new program or intervention. And ultimately, you all work together to agree on which intervention you want to pursue. And these are the interventions that you feel are most likely to have the greatest impact in your community. And in the assessment phase, you pretty much evaluate your program to see if it's effective or to see if there's things you need to fix with the program so it will ultimately become more effective. So CBPR really aligns well with the SARA model, which is being used in community policing initiatives across the country. So how can CBPR help police tackle methamphetamine use in your community? Well, first off, it involves convening experts from different sectors in the community, like law enforcement, justice officials, behavioral health providers, people who work in education, people in recovery. These are all people who might have been touched by methamphetamine or have all worked to address problems in methamphetamine. And these folks come together, often enlisting the expertise of other researchers, and I'll talk about that in a second. Together, when you have people with all these varied skills, talents, and knowledges, they can come together, share and compile data or information pertinent to the problem from each sector. They work together to identify community strengths and barriers that need to be considered when you want to do an initiative to prevent or intervene in meth use. They problem solve as a team rather than rely on one person to problem solve, or only one person or only folks from one sector to come up with solutions to this multifaceted issue. And ultimately, you pool together resources whenever possible, and this could involve money, labor, most importantly, brain power, and sometimes in-kind donations. The list can go on. So when you convene all these folks to the community, you might invite researchers from your community, from nearby communities, or elsewhere. It really depends on your needs. The ultimate goal is to establish long-term linkages with these researchers or evaluators to, perhaps undertake a local needs assessment on meth problems, strategize about methods for prioritizing the problems that you need to address first, or to identify and select among appropriate interventions. The researchers can be very useful in training local folks in program and intervention planning, help with implementation, and in evaluation design. What's nice about engaging researchers is they'll often help you procure funding and other resources to do all of the above. But this relationship really depends on trust, and trust takes time to develop, so that's something to keep in mind when you start engaging in CBPR. Why is CBPR relevant to Native American communities? Well, first off, it takes into account the history of outsiders coming in to do research in Native communities that's of little or no benefit to the communities, often done without local permission or the active involvement of community members. So CBPR really tries not to operate in this mode. And that's the mode that I shared with you in that first scenario of the East Coast researcher. In many communities, people feel coerced into participating in research. They feel researched upon. Well, CBPR tries not to do this. It tries to overturn this power dynamic. CBPR is all about promoting cultural competence in research versus cultural incompetence or insensitivity to community concerns or issues, as in that first scenario I shared with you. And CBPR really tries to overcome long-standing problems of research data and findings not being given back to the community, or as in that first scenario, the all too common scenario from decades past, data being used to portray Native American communities in negative and often very stigmatizing ways that really don't reflect what's going on in communities. Why, again, is CBPR relevant to Native communities? As mentioned earlier, it really highlights the importance of community voice in every single aspect of the research process, from conceptualizing what you're going to look at, from thinking about the best questions, from thinking about the best methods to use to research those questions, from analysis, interpretation, to intervention development. The community is totally involved in that entire process. So it promotes community ownership and control over this process, rather, again, than the outside researcher coming in saying, this is the way we have to do it. It facilitates trust between people working in different sectors in the community. So, sometimes you find that, healthcare providers might be critical of what the cops are doing or vice versa, and the judges aren't doing this, and, there might be tension across sectors. By working together, it helps overcome these tensions, and it also helps develop trust with researchers who are there to lend their skills, their talents, to help address community needs as defined by the community. CBPR helps ensure that programs, interventions, and policies developed through the research process are both relevant to and tailored to communities. I'm sure many of you have heard about scenarios where an intervention developed, in New York City, folks are trying to implement it in a Native American community context, and they're not tailored. So those interventions are likely not to be that effective. CBPR helps ensure that interventions are tailored locally. And it also increases the prospects that results in interventions will not sit on a dusty shelf, but will be put to good use. And that, in a nutshell, is your introduction to CBPR. And if anyone has any questions, please feel free to ask.
Thank you so much, Katie. Just a reminder to everyone, if you want to ask a question, just go ahead and type it into the Q&A box. It should either be a window on the right-hand side of your screen, or if it's not showing, if you click on the icon at the lower right-hand side of your screen that's a box with a question mark, it should pop open the window for you. And Katie, I especially liked how community-based participatory research can help build community support for law enforcement and other public safety efforts. And so as we're waiting for a few questions, I wanted to just ask, what is the role for law enforcement in community-based participatory research?
Well, I think law enforcement has a critical role to play. Particularly when it comes down to conceptualizing the research questions and interpreting the data. You might not need law enforcement to be so heavily involved in the data collection phase of CBPR, but it's really important that they're there for the upfront process. What are we going to look at? How are we going to look at it? And then when the findings start emerging, law enforcement needs to share its special knowledge in interpreting those findings, because the law enforcement folks really do have a particular vantage point. They have particular perspectives to share that people in other sectors don't necessarily have access to. It's also important for law enforcement to have a say in the programs that are developed out of CBPR projects. So it's important for them to be involved in that phase as well. And the level of involvement really will depend on the particular police department and their manpower issues. I think it's important for folks interested in CBPR to get support from, the leaders in their department, who can, make sure they're able to attend meetings and that they're actually able to engage in this process. And that might involve a negotiation. But ultimately, if they're there up front and they're there when the data comes in, that's really important involvement to foster.
Thank you for that answer. And I would just like to remind everyone that as part of our Tribal Mess Summit, there's going to be a pre-summit training on community-based participatory research, and it'll be held on the Monday, so April 30th. So if you want more information about how to actually do CBPR, that training will provide a good introduction to how to go about doing CBPR. And with that, I also wanted to let you all know that there is a survey that we're hoping that you will fill out about today's webinar. It should have popped up on your screen a little while ago. So as you are thinking about questions and writing them in, if you'd also like to take a minute to fill out the survey, we would greatly appreciate that. We use that information to be able to improve these webinars as we move forward. And Katie, I have another question for you. Can you share with us a little bit about some of the communities who have actually, the Native American communities who've done CBPR, and an example or two of how they've used the data, using sort of specific examples for us?
Well, I can give you examples from the Navajo Nation. So, for example, a colleague and I were doing a public safety we're involved in a public safety CBPR project surrounding agricultural injury. And what we did is we worked with local farmers and ranchers to develop a needs assessment tool, which we then trained the farmers and ranchers to implement on the Navajo Nation. Basically, we were looking at agricultural injury from the perspectives of local folks. We then worked with the farmers and ranchers to interpret the data, and after that process, developed a series of interventions to reduce agricultural injury among both adults and youth. These interventions turned out to be very successful. What started out, I believe, as a 3-year project turned into a project now approaching a decade. And there's trust between the investigators, the researchers, the community members, and it was definitely a co-learning process. So, for example, when I became involved, I knew very little about farming and ranching. And I was given a pretty good education on key issues from the local Navajo stakeholders. When we developed the survey as well, we found out that our approach to asking Likert scale questions, and that's when you ask on a scale of 1 to 5, what do you think about a particular issue? We found out that that was a culturally inappropriate way of asking the question. And together, we worked with our stakeholder group to develop alternative strategies for getting the same information. We also worked with our local stakeholders to interpret the survey into Navajo. And a lot of people don't read Navajo, for example. But what we were able to do was create a recording of the appropriate way of asking questions that the folks collecting data could then consult to ensure that they were asking the questions in the right way. So that's one example. There's several examples where, in my home state of New Mexico, where both tribes and pueblos are working with researchers from the University of New Mexico to do community engaged projects. One of our local researchers, her name's Jessica Goodkind, recently worked with one of the tribes to develop youth-oriented substance use interventions through a very well-planned community engagement process that was very much led by the community. It went through, institutional review board processes within the tribe, and it's been something that the tribe has been used to advocate for increased resources to deal with their youth substance use issues. So those are a couple of examples that come to mind.
Thank you so much for that. We do have a question from one of our participants as well. Lakota Holman is one of our Tribal Math Fellows, and she has a question regarding IRB. She asks, do you need to approach IRB before or after local community level work? In her experience, she's gone through IRB first and then approached the community and research and changed to the point where it was more time consuming than putting through IRB afterwards. So which comes first, I guess, is the question for you.
You know, it really does depend on the community. Some IRBs want you to approach them, you know, as soon as you know that a research project is on the horizon. The best advice is to engage the IRB as early as possible, but the IRB often wants to have evidence that, you know, researchers and community members have been working together on the proposal. So there needs to be, you know, some level of work together before actually approaching the IRB. In New Mexico, the example I'm most familiar with is the Navajo Nation IRB. So you'll work with community members to develop your proposal, and then you actually have to share that proposal with people in different communities before you can even approach the IRB. It is a time-consuming process, but it often leads to a richer research project. You know, some tribal IRBs, you know, are fine with you coming to them after, you know, funding is on the horizon for your CBPR project. But it really depends on, you know, the local setting.
Great. Thank you so much, Katie, for all of your information that you shared with us today.
Hello?
That completes our time for today. It's just a few minutes past the half-hour mark. We'd like to thank all of you who have participated in today's webinar. And just to let you know, to download previous webinars and handouts, and to download this one in a few days, you can go to www.methpedia.org. You can also go to that website to sign up for our summit if you haven't done so already. Thank you all so much, and we really appreciate your time with us today.